While the government is carefully studying the next steps to take in its response to the COVID-19 pandemic, President Duterte ramps up the search for a vaccine. Our Trisha Tarada is on the phone with the latest.
Pia, President Rodrigo Duterte is offering a 10 million peso reward to any Filipino who will discover a vaccine against the deadly COVID-19. The president has earlier been criticized for his military approach in dealing with the coronavirus crisis. But Malacanang says there's nothing scarier than the threat that COVID-19 poses. It's a new disease without cure, and the best thing to do for now is to really take precautionary measures, authorities advise. Back to you.
Trisha, the president met with experts last night. What were their recommendations?
One thing is very clear at this point. Experts are not recommending a total lockdown. Former Health Secretary Janet Garin is suggesting to study which areas have significant number of COVID cases. Then once known, she suggests a continuation of the quarantine in these areas. Another former Health Secretary, Jaime Galvez-Tan, recommends a comprehensive communication plan and identifying the critical areas. Professor Mahar Lagmay presented a study from the University of the Philippines showing that enhanced community quarantine has somehow slowed the increase of coronavirus cases. It would be best to continue the lockdown, they say, but they acknowledge there should be a balance with its impact to livelihood. Possible option then would be a gradual relaxation of the stringent quarantine. There was also a consensus that the ECQ doesn't have to cover the entire Luzon. Still, the president has yet to make a decision, and for now, all these are just options. Pia.
Well, Trisha, in case the president goes for what's called a modified enhanced community quarantine (ECQ), will our health institutions be ready for that?
Presidential spokesperson Harry Roque says the health sector has enough preparations. In case of a modified ECQ, the government and experts know there could be an increase in cases again. That can be handled by health institutions, according to Roque. Government cities or sites that the readiness of HealthOS 1 centers, and these are the converted facilities that will house COVID positive and suspect cases. But there are still complaints from health workers about the lack of protective equipment, and the government promises to provide more protective gear in the coming days. More than 76,000 sets of protective equipment are due to be delivered by Friday, while a group of local suppliers can now produce 10,000 sets of protective equipment per day. Pia.
At least 40 health workers, Trisha, in the main testing center, RITM, are now infected by COVID-19. What do officials say about this, and how does this affect the release of test results?
Well, the Task Force for Coronavirus says this is precisely the reason why the health department can't just accredit laboratories. With the incident, the IATF is expecting subnational laboratories to handle possible backlogs, and the government is also planning to hire additional health workers while our ITM staff infected by the virus are getting treated. Back to you, Pia.
Trisha Tarada there reporting.